Hi, I'm Sam Raypuck. I'm the Executive Director here at the St. John campus. I just wanted to take a minute to welcome everybody and thank you all for coming. We're very excited and very honored at the turnout that we've received for this event. So thank you so much for coming. We're going to start. Mayor Hartong is going to do the invocation before we start, and I'll have him come up. But thank you all for being here. And if you have any questions or anything, I'm sure we'll be hanging around at the end to answer anything that you might have. All right.
Thank you. Welcome to Mars. It's always kind of fun to go as mayor of Mars and go somewhere else and say, I just flew in. And so it's a pleasure to have this group to be in our community today. Let's pray. Heavenly Father, we pray that you'll be with us during this time to help us have good conversations about caring for those in need. Help us during these times of change and uncertainty to have clarity about how we're to help our neighbor, however that may happen. In Jesus' name we pray. Amen. Amen.
Thank you, Mayor. Next, we have Joe from SWEPA coming up. Angelelli, I think I said that right. All right, Joe Angelelli, thank you.
Thank you, Samantha. Hi, everybody. Thanks for coming out, and thank you to St. John's community for welcoming us here. So my name is Joe Angelelli. I'm the board president of SWPA, which is the Southwestern PA Partnership for Aging. We were founded in 1988, the year I graduated from high school. And we represent 10 counties in southwestern Pennsylvania. So we have many organizations such as Lutheran SeniorLife and others who have been a part of our organization all these years, who help us to advocate on behalf of older adults and persons living with disabilities. We have a policy committee, an education committee, a fundraising committee, lots of other great work happening. We do convening and networking events. When the Secretary of Aging, we invite him out, usually him or her, to give top remarks to our different conferences. So we really are kind of a neutral ground for folks to come together to talk about these important issues. I want to just recognize a few of the other board members of SWPA who are here today. David McDougall is here. Thank you, David. Jeff Caraway. Thank you, Jeff. And Jill Yesko-Diana as well. And Debbie McCarthy-Arnone is our policy co-committee chair as well. So thank you very much for coming out. We also have folks here I know from Lutheran SeniorLife staff, and David Feniletto, thank you for your welcoming us and inviting us here. So what I'm going to do briefly is give a little bit of an overview. We have the Medicaid fact sheets that are over there. I'm going to hit some of the high points of that. So I love history and did some research on St. John's community. It was founded in the north side of Pittsburgh in 1893, but this is a snapshot from August 31st, 1902, which was on the day before the dedication of the new home out here in Mars. So it was really, and also found in 1965, notice of the addition that was planned back then. The Lutheran home out here got a $550,000 addition. Also in 1965, what else happened in 1965? No. The signing of Medicare and Medicaid. This is the signing ceremony. That's President Harry Truman on the right, and obviously LBJ there signing both Medicare and Medicaid. Folks may remember or know that Medicare and Medicaid really were the brainchild of Harry Truman in 1945. He gave a famous speech about needing to create a system for folks, and it was 20 years later when it finally happened in the passage of Medicare and Medicaid. So we are celebrating the 60th anniversary of Medicaid and Medicare this year. And of course, I got a little formatting there, but in 1973, this was the building dedication for this building here in St. John's. And I love at the end, they talked about the Reverend Leonard Schultz, pastor of Trinity Lutheran Church in Avalon, vice president of the board of directors, spoke at the initial service, and his theme will be, I love you, which is a lovely thing. So this happened because of the Medicaid program. So, Medicaid program created the resources and the Medicare program for this building to be created. Basically, the demand was out there, and it was a public program that was formed to meet that need, and so that led to the building of this very building. I also like this from that day. Also sharing roles in the groundbreaking will be 3 residents of the home. These include Mrs. Mary Philibbaum, 90, formerly of Bethel Park, where I'm originally from, William Hook, 93, of Mars resident, and George Wright, 83, formerly of Butler and father of the board chairman. So back then, it was a high involvement organization, which Lutheran SeniorLife is very, very well known for involving everybody in the solutions. This is certainly what we're here for today. So these are just some of the high-level stats that are on the fact sheet, but of the Medicaid program. So 26,000 residents of Butler County rely on Medicaid for their health coverage in some form. 31.4% of those, of all children in Butler County rely on Medicaid or CHIP. CHIP is the Children's Health Insurance Program. It's actually founded in southwestern Pennsylvania here. Folks know the story of the CARES program back in the late 80s and 90s. Really, the community came together when all the steel mills were closing down and the families couldn't insure their children and wouldn't let their children go out to play outside because they didn't want them to get hurt. And so they worked together with the local Presbyterian churches, actually came together and started funding families in the Mon Valley, all over, I'm sure, but it was down in the Mon Valley where it was most acutely felt. And they created the CARES program, got Mr. Rogers to help to advertise it, and it was so successful that the state of Pennsylvania made it part of their Medicaid program. And then in 1996, President Clinton formally made it part of the national program. So lots of innovation is in our region here, a lot of history with the CHIP program in particular. 14.8% of seniors rely on Medicaid, and 15.6% of non-elderly adults rely on Medicaid in Butler County. These are just some stats. It got a little funky here, but that's okay. 20.8% of the Butler County residents are over age 65. And this is a snapshot from the Butler County state plan, or Butler County plan for aging, the 5-year plan that was published a few years ago, 2024 through 2028. But you can see, in particular, the population of folks over age 85 at 44,321. That population is projected to outpace all other segments of the population over the next 20 years. I know a stat, I'm not sure the analysis has been done for Butler County, but in Allegheny County, right now in 2025, there are 35,000 folks over age 85. In 15 years from now, in 2040, that number will be 60,000. So the number is going to grow 70% in the next 15 years. So as we're considering the Medicaid program and potential cuts to it, those are being discussed in the context of that rapid growth of the old population who, as we know, are those more likely to need long-term supports, which is what the Medicaid program funds in terms of older Americans and individuals living with disabilities. 3,400 individuals in Butler County receive help through the Medicaid program known as Community Health Choices. So this is the program that supports people in this building in leading nursing home level of care in a congregate setting here, but also the people that are living out in the community receiving home and community-based services, so receiving home care visits to provide services. So there's 510 residents of Butler County receiving what we call HCBS services out in the community, and there are 685 individuals in Butler County, it's cut off there, but are in nursing homes in Butler County. And there are 12 nursing homes in Butler County that receive Medicaid funding. And all this is on the fact sheet over there. Get more clarity. There are actually 63 community living homes with 194 individuals living in them with intellectual and developmental disabilities, and the Medicaid program funds that as well here in Butler County. And those are for individuals with, as I said, intellectual and developmental disabilities or autism. These are stats from the Department of Labor. There are 3,000 people employed in Butler County's 87, quote, nursing and residential care facilities. So that's more than just nursing homes. It's personal care homes and other residential care facilities. And collectively, they earn $130 million in annual wages. And then there are thousands of folks working for 179 different social assistance organizations in Butler County. In 2022, Medicaid funded nearly $11 million worth of home and community-based services provided by many of their 18 home care agencies who are licensed. They have their business license in Butler County. As we know, there's many home care agencies that are in the surrounding counties that support people in Butler County. So those 18 home care agencies are just those that have a business address in Butler County. And Medicaid paid over $38 million to the 12 nursing homes in Butler County. Medicaid importantly also reduces the frequency of uncompensated care provided by local hospitals and health centers to low-income residents and lessens the strain on county budgets. So because of Medicaid, hospitals, local hospitals, health centers don't have as much uncompensated care. And in our system, uncompensated care often falls to county resources. So Medicaid is a stopgap for the county budget. And it's generally more cost-effective care. If we look at the Medicaid spending, Medicaid per enrollee spending has increased much less than other payers since 2008. So it's gone up 30%, the Medicaid program. Medicare has gone up 50%. This is per enrollee spending, and private insurance has gone up 80%. So it is, and then you can see the share, and this is an important slide because it shows the federal contribution to the Medicaid program in Pennsylvania is 56% of Medicaid spending. So the $880 billion cuts over a decade that are being considered for the Medicaid program, it will come out of that 56%. So that's less money coming into the state of Pennsylvania. Our state legislators will have to find other ways to they'll either have to cut the services or they'll have to find other ways to raise revenue or cut other programs. So the cuts to Medicaid that are being considered have a ripple effect in terms of all other services that the state pays for. And it's important to know that, just block granting, as people are discussing, or a per capita cap or a block grant would not really reform Medicaid fundamentally. It would, again, just shift these expenses to the state and county taxpayers. And so that's, that's what we're considering here today. That's why we're meeting, to talk about the implications for Butler County and what these potential cuts would mean. And this is just another slide from that day 60 years ago when folks long before us came together and had the vision to create a program where it supports people to live with dignity and support and employ a lot of people in our communities. And we're here today to talk about what it means to other individuals who have been affected. So with that, I'm going to turn it over to Samantha to talk a little bit about who's the executive director here at St. John's, to talk about what it means to this community.
Thank you very much. Thank you, Joe. That was very informative, very well said. Jumping off of what Joe said about cutting Medicaid affecting other areas of our healthcare system, not only would it affect other areas of our healthcare system, but I like to tell people that when we have residents in our facilities, we're caring for more than just that resident. We're caring for their sons and their daughters, their loved ones, their neighbors. When they're here, their family members are able to be family members again, as opposed to being caregivers. We're taking that burden off of them. Those individuals are people who work, who have kids themselves, who might not be able to physically take care of the individuals that we take care of. So when we're caring for our residents, yes, our residents are our top priority, but you have to think of it as a ripple effect, as a domino effect of how it's going to affect everyone else out in the community. So who are our residents? At St. John, I have about 100 residents who are on medical assistance. Out of the 140 40 residents total. So that's about 75% of our residents rely on medical assistance to cover their stay here. And these are hardworking individuals that have lived long lives, their fathers, their mothers, their aunts, uncles, neighbors. They were involved in their communities. They've done so much, but they've outlived their resources. And now they need medical assistance to cover what they are no longer able to cover. And we're able to provide that to them. A cut to medical assistance is already, it's already hard to cover our expenses with what we're getting reimbursed now. A cut to it would just be detrimental to any of the services that we'd be able to provide, to the number of people we'd be able to provide services to. We all know that there have been increases in staffing mandates. There's the Pennsylvania staffing mandate increase. There is a CMS, a federal staffing increase that's working its way through. I can't imagine how we would be able to afford the staff that we need and to be able to pay these individuals who do the hardest job anywhere, I would say. They're the CNAs, the housekeepers, the dietary, activities, nurses, all of them. They're so hardworking and they care for our residents more than you can even imagine. And to cut Medicaid and not be able to pay them what they're worth would just be, it would just be a blow that I don't think would be fair to anybody. So I guess all of that to say, Medicaid, yes, it would affect us. It would affect us and our residents, but it would affect everybody that works here. It would affect everybody out in the community who has a loved one who maybe doesn't need medical assistance now or needs skilled nursing care now, but might need it in the future. And that would be for people who only need a short stay too, but we can't continue to run a business for the short stay residents if we can't afford to keep our residents who are here long term. So all of that said, Medicaid, a cut to Medicaid would just be detrimental to all of us across the board. And I think we all know that. We're all here because we know that. But for anybody who isn't reaching out to their local legislators, to their local representatives, this is what you need to tell them, that it affects more than just our residents here in skilled nursing and our residents out in the community. It affects everyone, and it's going to have an effect on you, and it's going to have an effect on their families and our staff and pretty much anybody that they represent. So that is what I have to say about that. I have Leslie Kiesau here. She is the director for our life programs, and she's going to speak on her programs and why Medicaid is so important for them.
Thank you.
Thank you.
Hello, everybody. So, as Sam said, I'm Leslie Kiesau. I'm the executive director of our life programs here at Lutheran SeniorLife. We currently have 4 programs. We cover the whole county. We cover Beaver County, Butler County, Armstrong, and Lawrence County. We serve over 680 individuals among all 4 counties, and in Butler alone, we serve about 165. The name LIFE stands for Living Independence for the Elderly. It is known nationally as PACE. Life organizations care for older adults who wish to remain at home rather than living it in a facility. Life provides these older adults with high quality of care and quality of life. We simplify access to care, and we save taxpayer dollars. Notably, the state Medicaid programs estimate the state programs say the life program saves the state 12% over other Medicaid programs such as Community Health Choices and some others. So life programs provide coverages for doctor visits, specialty visits, prescriptions, durable medical equipment, all without cost to the participants in the program. We also provide services that include physical and occupational therapy, meals, transportation, in-home care, including bathing, dressing, meal prep, and housekeeping. Our teams consist of doctors or nurse practitioner, social worker, dietitian, physical therapist, occupational therapist, RNs, home care coordinators, transportation managers, caregivers, and recreational therapy. For older adults to continue to receive the high-quality, cost-effective long-term care services and supports from life organizations like mine, a robust and well-funded Medicaid program is essential. We receive 50% of our funds through Medicaid, and the other 50% come through Medicare. With Medicaid cuts, that will mean we will have to reduce our staffing. That will mean our transportation will suffer, our meals will suffer, all of our services will suffer. We are a vital program that allow individuals to remain in the community for as long as they can, and we help people who've been deemed nursing at home eligible remain in the community. We support loved ones. We support caregivers. We provide respite services. I can go on and on for days about what we do for folks. But for us, a Medicaid cut would be, as Sam said, it would be a blow we probably couldn't recover from. Sam touched a little bit on staffing. We've had to increase our staffing. We've had to increase our wages just to remain competitive in the open market at this point. So, I'm respectfully requesting everybody here, if you haven't done already, please reach out to your legislator. Let them know that this is a very serious situation and something that they need to really consider, voting against. And, it is going to affect everybody here. So I have brought a couple of wonderful individuals who volunteered to come and speak a little bit about the LIFE program. They're husband and wife. This is Albina and David DeRiggi. They are members of our Life Butler community, and they're just wonderful participants, and they're going to just talk a little bit about what Life does for them and helps their lives. Albina.
Hi, everyone. I have a autoimmune disease, and I need a visiting nurse to come into the house. She comes in the house 6 days a week to do bandages and take care of, my needs, because I'm constantly, my legs are a mess. I would not have a leg if it wasn't for that program. They just do it. It's unbelievable what this program does for the individual. They take care of us so well. All I have to do is pick up the phone if I have a problem, and they're there. I can have somebody come to the house and help me. Like I said, 6 days a week they're in the house, and the seventh day I'm up at the center, and they take care of me up at the center. But if you've seen what my legs look like, even with gross that, they are horrible. And like I said, it's an autoimmune disease, and it was caused by having too many surgeries too fast. And my white blood cells decided that they were going to take over and fight my red blood cells, and I'm just a mess. And without the LIFE program, I could not exist. It's unbelievable that I just would not be able to walk. I walk with a cane now, but I would not be able to walk because I haven't had a leg. So, and my husband is here, David. You could see David. He is also a member. He's been a member longer than I got been.
Yeah, I'm a member. I've been a member a lot longer than she has. I was a member of Life Pittsburgh, the Life Pittsburgh organization, which was not a great organization. Not as good as Life Butler.
Life Butler. No, seriously, Life Butler is fantastic compared to Life Pittsburgh.
Yeah, it really is. Life Pittsburgh did what they could do, like on meter scraps almost. I don't know. They took care of a lot of problems because they didn't have. I don't know. The funding seems to be more available to Life.
He was in the bed for 3 years.
Yes.
He was bedbound.
Yeah.
And now with Life Butler, he's now up and in a wheelchair.
Yeah.
But he was bedbound with Life Pittsburgh.
Is this? They did what they could do for me. But it just seems like when we moved out here to Butler, and that wasn't by choice. That was by, we had to go. We
had no choice. We had to move.
We lost our housing in Pittsburgh. Yeah, I'm good.
I-
Oh, the wheelchair, yeah. Wheelchair here costs, I guess, around $25,000 for this wheelchair. I mean, it's a beautiful wheelchair, and so
It gets around.
I can
Without,
ride, I can go wherever I go with it. I mean, it's just amazing piece of equipment. Without it, you know,
without this whole program, he would be still bedbound and I wouldn't have a leg.
yeah. I mean, it's just, it happened, boom, boom, that fast. It was, you know, I don't know what to say. I'm very thankful for this
I
organization.
was like, so mine.
Yeah.
I could not,
Yeah.
we could not survive without it.
Yeah.
I mean, they take care of all our medication,
Everything.
all our
All the medicines we take, everything. It's
the
You
supplies
mind-
we need.
anything I need. She picks up the phone. I tell her. She picks up the phone, calls, and they come down with it.
Same
Saturday life. I mean, it's just,
And
No.
they take us twice a week up to Butler.
yeah, and they also send assistants to the house.
Yeah, you have nurses come down, put you in and out, take you in and out of bed. CNAs come.
Come at time to say.
They're so fantastic. They just do whatever you need.
Yeah, I mean, it's a great organization.
Oh, God, yeah. And if they cut anything back, we would be
Yeah.
in bad shape. We would be.
Yeah, it
They
would be.
can't take away anything.
Can't. I don't know why they would. It's stupid. I mean, I know it's a matter of tax money, but, you know, I mean, what else are we gonna keep your money for? Send it, help people, you know, that's,
We've all worked hard all our lives,
Yeah.
you know, with both, you know.
Yeah.
And you can get to the point where sometimes you just can't afford what you need to have done. Well, thank you.
Yes.
I know there were a few other folks when you came in. We asked if anybody would like to say a few words. Catherine?
Yeah.
Yes. Would you like, the mic can come out to you if that works for you?
My name's Catherine Lalonde. I have a son. My firstborn child was diagnosed at 26 months with autism, and he's 29 now. So he's, ever since he was diagnosed at age 2, has been getting therapy paid for through Medicaid. You know, a lot to do with behavioral therapy. Physically, he's very well. He's like 6 feet tall and has no trouble moving around. He's, you know, physically fine, but he's had extensive therapy. We did everything we could think of to try and help him, you know, improve. But, you know, it's limited. So, but he had, you know, extra help through school and the special education, that also elements of that covered by Medicaid, after school programs. He currently goes to a day program in Mars, actually, and they go out around the community and help out with things like the food banks and the libraries, and, you know, helping the community. And just a year ago, March 1st, he moved into a supportive housing, one of the people on that list, in a community home in Butler. And actually it worked out well, because a close friend of mine I met when the boys were about 3 years old in an autism support group. We hoped that they would be able to live together because neither of us has family here. And, you know, it's, in our type of situation, the constant worry is, if I'm not here, you know, since we don't tend to live forever, you know, what's going to happen with him? And so it is a great relief to know that he's, you know, got support, and he still goes out, helps around the community, takes part in things. But, you know, to look at him, you wouldn't know there's anything wrong with him. But he is very vulnerable, as a child is, because he usually just says yes to everything. You know, if someone came to the door and he answered it and said, "Can you give me $20?" Well, yeah, okay, and do it. So he needs like protection, because he just doesn't understand. So, you know, it's a great concern to people like me that mainly, what happens when we aren't alive anymore. So I appreciate what Medicaid does and understand what it does for a lot of people. So thank you.
Thank you, Catherine, for sharing that. Are there other folks that would like to share any perspectives or personal? Yes, Jill.
So just besides my involvement with SWIPA on the board, I started a nonprofit called Safe Moves for Seniors about 2.5 years ago. And everybody that receives my services, which are free moves from, A to B, when they're living in unsafe housing, they get a free move and they get to be packed and unpacked and the whole thing in the truck. They are all making an average of $800 per month for their income on Social Security or SSDI, which is, this Social Security Disability Income. I can't imagine what's going to happen to them. And not only their housing situations, but all the services that come into those senior housing communities, like Meals on Wheels, and that there's just layers and layers and layers. And thank you for the Life program, because I've gotten so many great referrals from Life. We are trying to get into all the 9 other counties other than Allegheny, working on that with Hillman right now. But I just wanted you to know, I see the horizon of this, and it's sort of, terrifying for them. And there's just, so many things I think we can do and we can say, and not just out of fear, but, just talking about, our observances of all of the ripple effects that this is going to have, not just on older adults, but people with disabilities that rely every day on these dollars. So, can't say it loud enough or often enough, but please get in touch with your legislators. They are listening, and the volume of voices that they hear, the many, many voices that they hear will make an impact. So please, don't stay quiet about this.
Thank you, Jill. Yeah, and I think this is obviously a federal issue at the moment, and the decisions being made on the federal budget resolution that's being advanced as a bill. But the implications will come to the state level and to the county level. So making your voice heard to state legislators is just as important, even though they can't themselves make the decision. They can certainly make their voices heard to folks that they know and who may be prone to listen to them if they understand the implications that will come down the pike, as they say. Other questions or comments that folks might have? And I neglected to recognize Jen Blatz, another SWIPA board member who organized 90% of this today with everybody else's help. Thank you, Jen. So open it up to questions, I guess, that folks might have. Yes, Catherine.
If you go, people can go to the county commissioners meetings that are every 2 weeks. And after they have their meeting, there's a public comment time where you can have 3 minutes to say your piece. And I would encourage people to go to that because, like you said, telling, the representatives who are closer to us that you can access more easily, they can pass on messages to their colleagues, in the state and federal level. So you can go on the Butler County Commissioner's website. It tells you when the meetings are, and I encourage people to do that.
Thank you, Catherine. Yes, Jen.
Thank you, Joe. So again, I'm Jen Blatz. I'm on the SWIPA board, and yes, I was the person who started pestering a lot of you the last couple of days to come out and join us to talk about this. So I also have bronchitis, but I'm not contagious. This happens every year. So we're going to talk in a minute about what we're going to do next. But I do have here some sample language, if you need any, for writing to your members of Congress and to both of our United States senators, and just wanted to acknowledge that Bobby Maggio is here representing Senator Butterman. We did invite every elected official in Butler County. A couple of them responded and said that they couldn't be here for various reasons. So I just wanted to let you know that that offer was extended multiple times in multiple different ways. Part of the issue here, I think, is that we are separated too much. There's a conversation going on in Washington. There are conversations going on in Harrisburg. So when they come home to their districts, and this week is the recess week, we cannot let these people hide from us. We need to find them every day. Every commissioner's meeting. We have to keep the pressure on constantly. And we did get a little reprieve because we have a 6-month, whatever this thing is, that they're doing in DC to keep the government open. But we've got to keep the pressure on. So Joel will take some questions, but I just wanted to show everyone, this is Ada. Ada is my step-granddaughter, and I will die on this hill. This is the hill I'm dying on. Ada is 16 years old. She has an incredible life because her parents can take care of her at home. They have built a school in their house so she can be homeschooled. They have done every single thing that they can humanly possibly expect to do as parents. She was very fortunate to be born to parents who could do this and advocate for her, but this is the reason that we have to fight against these cuts. Ada's aide, who comes to help her at the house, is paid a whopping $16 an hour. If we lose that service, if we lose that, her little sister here, Una, who's also in the picture, isn't going to get the attention that she needs at home. And her other sister, Wilhelmina, isn't going to get the attention that she needs at home. So keep thinking about every single person you know who has somebody in their home or in a wonderful place like St. John. Keep thinking about them. When you're sick of calling your congressman, when you're sick of calling, and again and again and again, we have to keep pushing, or the silence will be truly deafening. So thank you for listening to my little speech.
Advocacy and get out. Less feedback. Okay, so opening up for questions. Surely there's some questions, Hill. Yes.
Where does funding come from the state government? So if the federal government stopped funding Medicaid and Medicare, what are the resources that the state of Pennsylvania is permitted to take us? Like, is it property tax? Is it, what is it that they're allowed to?
I mean, it's income tax, it's property taxes at the local level. The federal government is not going to stop funding Medicaid. They're going to just cut back what they would commit to the federal match. But yeah, the states, they can't run deficits, so they have to either cut services or raise revenue, which will mean taxes or fewer services. That's the equation they face. And it's all, everything will be on the table, right? If the cuts will be significant enough that one would hope that they wouldn't just allow them to pass through so that they would have to cut other things, but then everything is suffering, schools, in the midst of everything else that's happening at the moment in terms of these other programs and federal government employees and right on down the line. As we're here to talk about Medicaid cuts, what do we need to do to actually invest in the future rather than just defend against cuts? Well, it's a great question. The demographics that we're facing are clear. The status quo is not good enough. So the fact that we're talking about defending the status quo and defending against cuts, we actually need to invest new resources in these programs and do so in a way that is more forward-looking in terms of the potential return on investment, let's just put it that way. So we have a sickness system, right? Unfortunately, that we pay for kind of a lot of the wrong things after we've let them get to a certain point. And so we have things that we track like potentially avoidable hospitalizations and these other things that if we invested more upstream in social determinants of health, in better housing, in better food programs, in more integrated programs all around, it actually would save healthcare dollars, right? But to do that, we have to capitalize it. We actually have to make those investments. But we can actually do that at a state level. I mean, we have a 10-year budget window where we can say, let's, if we did the right thing, it would save this much money year over year for 10 years. Okay, that's a big pot of money that's out there. How do we actually borrow against that to capitalize these new programs? So it's kind of a social impact investment mindset that, like, there are evidence-based things that work, better housing options, better. I know Lutheran SeniorLife is a great innovator in sort of small houses out in the community as alternatives to larger institutional settings. Those actually have been shown to save dollars, right? Because it's better care generally. I mean, the research shows that it has fewer hospitalizations. So if we can do things like that, but we have to capitalize that. It takes money to create those systems. So that's the kind of thinking that we actually do need at the state level to say, let's think at a 10-year window here, right? With these projections, what kinds of investments can we make from an economic development perspective too? I mean, clearly if you drive along 228 here, things are hopping, right? There's a lot of new housing, a lot of Butler County's tax base, at least in this area, is pretty good because of all this new development. But there are other areas of Butler County, obviously, that don't look like this and need economic development, and that the state could play a role in leveraging that. So that's what I would love to spend our time on rather than this, in this defensive mode. But the more we can educate people just about how the system works, we at least have a fighting chance to make those cases, to decision makers who I think do get it. But they, it's the famous, folks want to do the right thing, but they kind of have to be made to do the right thing, right? Because it's who's knocking on their door with the answers and the questions. And we have to be those people, knocking on the door. So, other questions or comments? Well, this is getting you out a little early today, right? Thank you all for coming. Thank you for everybody who spoke, who shared your personal story. It really means a lot, I think, in terms of our advocacy efforts to speak with one voice about this, recognizing that the Medicaid program is bigger than just nursing homes, right? It's bigger than just home care. It's bigger than just developmental disabilities. It's bigger than just the CHIP program. It's all of these things together, and it's really a family program when we start thinking of it at that level. And Jen is passing around right now. What is Jen passing around? Remind me.
This is sample language for
Oh.
letters and emails?
Yes, sorry. So this is the call to action, is that, we're giving you some, if you want to write a letter, send emails. This is resources to do that with right at your fingertips. Well, with that, I think I'll just sort of formally close it and thank everybody for coming. And again, appreciate your hospitality at St. John's here. Thank you.